and welcome back to my channel. This is Bernice. If you've missed me, I've missed you too. Thank you for stopping by. Thank you for sticking around and all that jazz. Alright, I've been gone for so long because life is just busy. Life is just so busy, and like I don't have any other better reason. I'm back to work. I'm a retail pharmacist, and that means insane crazy hours. So like, I don't know, it's just now that I've been able to film this video, and I have a 12-month-old baby, and he's the cutest little thing ever. I've become one of those patient parents. Like, all I talk about at work is my little baby, my little baby, my little babies. Anyways, thank you guys for stopping by this channel. Today we're going to talk genetics, and I mentioned in my other videos that I did do a genetic test on my pregnancy before I decided to carry it to term. And the reason why I did that is because I'm a sickle cell carrier. Bae is a sickle cell carrier as well. That means we have a 25% chance of making a sickle cell, 100% sickle cell patient, you know, offspring or baby. So with this concern, it made it to a point where when I found that I was pregnant, it was like, oh my God. Because when we got together, he knew he was a sickle cell carrier, but I didn't know yet because, you know, I just didn't know. But my dad is a sickle cell carrier. I knew that for a fact. So I had to check to see if I was a sickle cell carrier too. And I checked, and obviously I was a sickle cell carrier. So boom, what do? After doing so much research, we now realize that you can actually test a pregnancy before it actually goes to term to see if the baby is just a carrier or a sickle cell patient or 100% AA. So if you are normal, you're AA. That means you don't have any sickle cell genes in your body. If you are 50% normal, which is what I am and Bae is, you're AS. If you're a sickle cell patient, you're SS. So this video, I'm making this video not to you know, look down on sickle cell patients, or not to say sickle cell is like the worst thing ever. No way, no shape or form this video is that. Like, this video is just to shed light on the fact that when you meet with somebody and you're about to start having babies, it's very important to talk about the genetics, okay? It's not just about being cute. It's not just about, oh, we look good together, we're gonna make cute babies. It's about the genetics, okay? Because sickle cell patients are like, they're all over the world. They go ahead to live normal and amazing lives. But if you had the opportunity to say, okay, if you had the opportunity to make a decision on whether you want to have a sickle cell patient baby or not, I think every one of you would take that chance, okay? So that's what we decided to do. We decided to test the pregnancy, and before we did that, the genetics department at the hospital, you know, wherever I was going to have the baby, they had us come in for some counseling. You know, just basically they'll talk to you about the fact that, okay, if you find out that this baby, or, you know, the fetus at the moment, if you find out that it is a sickle cell, so SS, what do you want to do about the pregnancy? Do you want, they ask you the hard questions. They're like, do you want to terminate, will you terminate the pregnancy, or will you keep it, blah blah blah. So like, we had to sit there and like make the tough decision, like, this is what we're gonna do if it turns out like this is what we're gonna do if it turns like that. So that's what all the whole counseling is about, because it's a tough decision, like, it's a difficult decision. And there are people who are like, you know, some people want to have babies but they can't even have babies. Who am I to even decide to terminate a sickle cell patient baby? But then this is a decision that you want to know and you want to consciously make, even to just prepare your mind psychologically, because sickle cell babies, when they come up, they have to go, you know, some of them will suffer from jaundice, some of them, there are vaccines that they need to get right off the bat. There are, you know, medications that they need to take, like some of them have to be on Bactrim all the way to like 5 years old, you know, just to make sure they don't get certain diseases and stuff like that. But this, like, being educated, like Bae and me, we're very educated, we're both in the healthcare field, and we couldn't just dive into this thing, you know, ignorantly and stuff like that. So so what methods can you use to check for the genetic makeup of a fetus or embryo or baby in your stomach? Let's try this again. So my camera keeps like cutting off. Part of the reason why I've not been filming is because my camera has been acting up. Anyways, let's talk about CVS, Chorionic Villi sampling. This is, so there is the baby inside the placenta, and then there is the womb or the uterus. So the placenta is connected to the womb or the uterus by some villi or tube-like things. So this is I'm going to show you guys a picture. Hopefully I can find a picture to illustrate this. But whatever links the placenta to the uterus or the womb is what is being tested during chorionic villi sampling. That means the doctor needs to send his tube through your vagina, through your cervix, into your uterus, and to the wall connecting the placenta to the uterus, and pull out a sample from there. It's kind of like a biopsy, and then that's what they usually test in CVS to get the genetic makeup of the baby that's in your stomach, that you're carrying it. So that's what I did. That's what I went through. And my experience with this was it worth it? Yes. Statistics did show that 1 in 500 women will have a miscarriage after this procedure. And you know, they gave us all the facts as far as CVS is concerned, and we still decided to go through with it because we really wanted to know. So again, you know, this is like personal decisions, and I just felt the need to come and tell you guys about my experience with it. The CVS was not like the worst or most painful thing. You know, it's just like a pap smear, but like an extensive pap smear. If you've gone to the hospital and had a pap smear done, that's what the CVS is. But again, this one, they use like two prongs to pry open your cervix. So not just your vagina, but the cervix all the way at the top. That part hurts, but they do numb it a little bit with some lidocaine. I think that's what they use. So the procedure starts by he used some betadine to like sanitize the whole area, and then put some localized numbing on the cervix, and then pulls it open. So with this procedure, you're gonna bleed. Well, they told me that I was gonna bleed for like 2, 3, 5 days, but no, they told me that I was gonna bleed for like 2 or 3 days, according to what has happened in the past. But I ended up bleeding for like 2 weeks, which had me scared. Okay, like that's that, but that's me though. Like if people are gonna bleed, like after I had my baby, I bled for like 2 weeks too, you know, but they usually say, okay, you bleed for, you know, a few days. Then I ended up bleeding for like 2 weeks. I was so scared. Maybe day 8 or day 9, I called the doctor. I almost went to the emergency room like, hey, what's going on? Why am I still bleeding? But it's not like heavy bleeding. It's just like spotting, because when they pinch open your cervix, it bruises the cervix. And also when they cause the puncture that they cause on the wall between the placenta and the uterus, that causes like a puncture, and that could cause bleeding as well. So unless it's like heavy bleeding, don't be like me and panic and freak out. You're not having a miscarriage, because that's what I was thinking in the moment. But yeah, so that was my chorionic villi sampling experience. We had to wait 14 excruciating days to wait for the results. Oh my God. I prayed and prayed and prayed. I'm just like, God, please, God, please, God, please, God, please, just see me through. Like, God has been so good to me. Like, I can't even begin to start to recount my blessings this past year. That 2018 has been the most amazing and life-changing year for me. So anyways, we got the results 14 days later, and the lady, when she called me, I was studying for my board exam, and I was just like, oh my God, these results will totally mess up my balance studying. And she called me, she's like, I have good news for you. Oh my God, it resonated in my head. I was like, oh, thank you, Jesus. She was like, the baby is a sickle cell carrier, just like you and the baby's father. So we don't have anything to worry about. The baby is 100% fine. You know, he's a carrier. So growing up, I need to talk to Amari, you know, let him know he's a sickle cell carrier, and whoever he decides to partner up in his life with, they will need to make sure that that person, you know, even if they're a sickle cell carrier, they need to go do the genetic testing like we went about it and stuff like that. But knowledge is power. That's all that this video is about. This video is not going to say sickle cell is like a death sentence. People live with sickle cell disease. They're perfectly fine. You will never ever know they're a sickle cell patient. Nothing. That's not what this video is about. This video is about the fact that knowledge is power, okay? And the thing is, with times changing and stuff, women are pushing the age that they start having kids. So like we're seeing more and more women having kids at like 35, closer to 40. Hell, Kenya Moore just had a baby at 40 something. So like women are having babies at older ages, and knowledge is power. I bet you all these celebrity women do genetic testing on their babies while they're in their stomach, because it is very important. And like when I was going through this process, a lot of the doctors, like the female doctors that I met, you know, like a lot of female doctors, they go to school for so long, and when it's time to have kids, it's usually like way advanced in their lifetimes. So a lot of them had gone through this chorionic villi sampling. To my dismay, it's like it's just one of those things that nobody really talks about until like you are actually dealing with it. But like my doctor, one of my doctors had this done as well, because she had her first kid at like 38 and her next kid at like 42 or something like that, she said. So she had to check for, like, it's not just sickle cell. Like this test pulls up the whole genetic makeup of the baby, and the lab people, the lab technicians, whatever you want to call them, they take the results and compare it to a normal genetic makeup and see like what is abnormal and what it stands for and stuff like that. So it can see if your baby will have, like, I don't know, this, she told me she did this for to find out for trisomy. Trisomy is when like the baby has like an extra, say the baby is like a boy is XY and a girl's XX, but trisomy will have like a baby having XXY or XXX and stuff like that. So with this genetic makeup, you can check that. And the good thing about this genetic test that we did is the fact that we were able to find out that we're having a boy like way early, at like 10 weeks. Usually you don't find out the sex of the baby until you're like 3 or 4 months pregnant. So it was amazing to know. I wanted to surprise myself at birth, like surprise myself when I had the baby, like, oh, I had a boy, oh, I had a girl. But you know, babe didn't want to wait. He wanted to know. He absolutely needed to know if we were having a boy or a girl. Anyways, so we found out we were having a boy, and we'll live happily ever after. But anyways, guys, that's it about genetics. If you are a carrier, if you're just a carrier, that means you're not full-blown a sickle cell patient. And the sickle cell gene is a recessive gene. I forgot to mention this fact. The sickle cell gene is a recessive gene, so you can never be dominant in sickle cell. You can only be a carrier or full-blown recessive. So SS is like fully recessive, and those are like people who suffer from sickle cell disease. And you know, to shed a little bit of light on the life as a sickle cell patient, you know, sickle cell patients mostly deal with joint pains, and that's just because their red blood cells are sickle. So the normal red blood cell is like a dome-shaped round shape, but sickle cell red blood cells are like C-shaped, and so this causes the blood and the red blood cells to go clog in the joints, and they're not carrying oxygen enough, and this just causes joint pains and all kinds of issues for them. That's like the most, you know, the most summarized explanation of sickle cell disease. And there is medication for you know, this condition. There's one medication that I'm very familiar with, which is hydroxyurea, and what this medication is, it makes your body to produce more of fetal hemoglobin rather than the mature or adult hemoglobin, which is sickle. So it will make your body produce fetal hemoglobin, which carries oxygen better than their sickle hemoglobin. You know, let's stop with the scientific jargon, but that's the long and short of it. If you like this video, please hit the like button. Thank you for coming back to my channel. Subscribe to this channel, and I'll see you in the next one. Hey.